Would you put your hands in the life, or your life actually, in the hands of a robot? See, I've messed it up already. I'm so confused about it. It's the latest trend in medicine here. Scarless Robotic surgery. Dr. Tirso Del Junco, who just performed 3 robotic surgeries today, is in studio with us tonight. First of all, welcome.
Thank you.
Robotic surgery.
Yeah.
What kind of surgeries did you do today?
Today we did the first single-site, single-incision gallbladder removal surgery in the state of California. We're the first community hospital in the state to do it. I think we're the 3rd hospital that's been involved just in the last month with this new FDA-approved product.
Is it all robotic, or is it you on a joystick directing the robot?
It's me operating the robot. I actually brought the device that we actually insert into the patient's navel, just below it, connect the camera and the instruments to it. I go to a console and operate the robot that's connected to the instruments.
So you're good on video games as well?
I wasn't as a kid because I didn't have any, but I had to learn.
You had to learn.
I've had to learn.
What sort of surgeries? You mentioned gallbladder today. What other surgeries or procedures would be applicable to this? The actual robot's been in vogue for quite a long time, probably in the last 8 years or so. Prostate surgery is where it was born with that procedure, and that robotic procedure now is the gold standard for men with prostate disease. Really making headways in the gynecological arena. I myself have done some female surgeries using the robot, and colorectal cancer. Obviously the gallbladder surgery. So what are the advantages of not having a surgeon's hands or somebody operating on you directly?
Well, you know, we've been doing laparoscopic surgery for 20, 25 years now, and so the whole idea of minimally invasive surgery is where we're headed. And faster recoveries, less post-operative pain, shorter hospital stays. Having my hands in someone's abdomen requires a large incision. Henceforth, they're in the hospital longer. Post-operative pain, return to work is a lot longer. So we're moving towards this arena of minimally invasive surgery, and now we're getting to 1 incision.
Okay, I see you with a patient here. Do you ever have trouble explaining it to a patient, having a patient sign on to the idea that you're going to be operating a joystick?
Well, it's interesting because these 3 cases, which, you know, today this is the first one.
You were busy today, weren't you?
We were busy today. These are the first ones that we did, and showing the device that I have in my hand being placed right now. You know, the whole concept of minimally invasive surgery is not new to patients, so we're aware of it, they're aware of it, so having the discussion with them was a lot easier. But here you can see we're connecting the robotic arms. That's actually the camera that's being connected to the device, and once we get these instruments connected, they'll show, I hope, us going over to the console.
So those are the robotic arms you're talking about here?
Those are the robotic arms that we're connecting to the instruments.
You know, I look at this device, and you would think it would require a big incision, but I guess
it's less than an inch. It's 3/4 of an inch, 2 centimeters, and that's me operating the instruments at the console. And
when we talk about it being inserted in and around the belly button, that's sort of the center of the body there. You can go many places, I would assume, from there? Absolutely. We can actually turn the whole robot around and work into the pelvis. And in this case, we're working up towards the chest. This is where the gallbladder is located. So we can move around the robot to fit where we're working. I'm not saying it happens a lot around here, but sometimes the computers and the robots have a mind of their own. Do you ever have issues with that? Thank goodness the robot listens to what I'm asking it to do. Obviously, the concern and the company Surgical Intuitive, who's put this whole product together, and they've got this thing wired. So if there's a backup pack, or if the electricity goes down, the robot is still functioning. And, you know, it's an amazing product. Where do you see this going in 10, 20 years? Well, you know, I think that I don't know that the technology is here. What we do with the technology is we're adapting what we're doing in open surgery now robotically. So the arena of building instruments so that we can take it to the chest to do heart work. They're starting getting into the thoracic surgery work. So it's getting the instruments to work in the areas that we need to work. So I think once we get the instruments working, there's endless amount of. Can you envision anything that would be off limits with this sort of thing?
Boy, you know, I'd hate to say as soon as you say no, they have us training to do what we thought we weren't going to be able to do. So I would think that where we've come in the last 10 to 15 years, that we're going to find ways to do things that we would never think that we could do.
Is it something you think people, if they're going in for any kind of surgery, they should ask their surgeon about?
Absolutely. And certainly with gallbladder surgery in particular, which is probably the most common procedure done in the United States, this technology is not widely available yet. It will be very soon. And it's just the limiting factor is getting instrumentation to the places where the robots are. But yes, it's here, and it's the cutting edge.
Tell me the recovery time again, in terms of days or weeks. If you go in for a typical gallbladder, it would be, what, a couple of weeks? And this is how long?
Well, they go in, it's done as an outpatient, so they go in the morning, go home the same day. Typically, depending on the type of work that they do, they can be at work a week after surgery. If there's more labor-intensive work involved, you know, you want to be a little bit more careful because of where the site is. And it can be anywhere from 2 to 3 weeks. But again, it's the type of surgical procedure you're doing. Gallbladder surgery, they're back to work really quickly.
Wow, it's amazing. Doctor, thank you so much
for
coming in.
having me. Pleasure.
Appreciate it.